this. You know, I personally have a own experience with injuries and stuff like that. I'm an Ironman, and I remember bringing out a foam roller 8 years ago and foam rolling on it prior, after the fact, getting all these massages, and man, I just want to share this with you because I'm really blown away. In your mobility the rest of your life. So I just want to share, you want to do it pre-sport, not afterwards. Okay? So I want to tell you a little bit about myself. I'll get really quick through that. I own a gym down in town. I have a physical therapy inside. They've helped me with all my information as well. It's Derek Toohey and Laura Homer, and we're a team down in town helping people stay mobile and strong. I'm a mother of 1 and a wife of 13 years. I'm very proud of that. Knowledge is power. So bear with me if I talk over your head a little bit with some of my lingo. I'm not trying to. This is part of the way I roll. You know what I mean? Because if I don't use it, I lose it. But if you have any questions afterwards, I'd love to talk to you. There is that iPad over there that has an awesome app on it. If you want to check that out, because it is so amazing. I in college did anatomy, right? And I worked on human cadavers, and we broke through fascia. We didn't even look at fascia. And here we are today, looking at fascia, the 13-mile fascial lines, and trying to understand it to give you better mobility, right? And all the way, trying to keep you from being injured. So, with that said, what is fascia? Fascia, I was just explaining, fascia is if you look at a chicken breast, or I pulled out a chicken with my mom the other day, a whole chicken because I was going to cook it. I was like, Mom, check this out. Pull it out from underneath the skin. I know this might be gross to you, but I'm kind of a geek. I was like, check out this white film. This is fascia. So we have that all over our body, but it's thicker in some places. And, it wraps, as you can read right there, it wraps and connects the muscles, bones, nerves, and blood vessels of the body. Together, muscle and fascia make up what is called the myofascial system. And you can see I'm kind of going through different tools of how we roll. And why do we roll? Okay. So what happens, what you feel, this is one of the things that they say that happens whenever you get those knots that you feel, is that the skeletal muscle and the connective tissue basically create an adhesion on top of each other. And what that does is it decreases movement because you have this sticking. Does that make sense? So you're gonna roll it out. You're gonna put pressure on it, and you're gonna roll it out and get rid of that adhesion. Isn't that cool? So now you know what we're doing and why, right? And there, most importantly, I want to talk about contraindications. We have people that have bulging discs, right? We have people that have osteoarthritis. I just want you to be very careful and let me know if you have any of these contraindications that I'm not rolling your spine, okay? Very important. Please don't roll over any ribs, any bones when we're rolling. I just want to make that very clear. So when you walk away from this, that you don't injure yourself, because it can happen. And then another thing is, if you've had a recent surgery and you're getting up and down from, you have low blood pressure, that's not great from coming up and down. And that's the help of my physical therapist in my office giving me lots of this information so you know when to roll, not to roll, does that make sense? Okay. All right. Dynamic warm-up. Dynamic warm-up. You'll see this on the sidelines of the NFL and the basketball team, even the Olympics. You saw them moving, right? Working, getting some mobility going. It's a series of movements, really important movements. As we sit at our desk all day, we tend to get, some of you might not sit at a desk all day. Some muscles might be shut down over time from doing certain things and not having, what's the word I'm looking for? Whenever you probably had muscles that shut down. And whenever they shut down, the likelihood of injury happens and increases tremendously. And that is why we do a dynamic warm-up before we do big movements. And we want to get everything turned on so that you don't have an injury. Anybody seen this? Let's hope not, but you never know. So let me explain that a little bit deeper. And I think this is really important. Reciprocal inhibition. Reciprocal inhibition is when you're seated at the desk all day and these hip flexors get really, really tight and your butt cheek, your gluteus maximus, gets really, really weak and long. We call this phasic, we call this tonic. And what happens is that what I just talked about, reciprocal inhibition, that when you get up out of your desk, right, you get all this tightness and your butt cannot turn on. And then you're going to go to a class, right? You're going to start to lunge and you're going to be like just dipping and doing all this weird stuff because you don't have these muscles turned on. That's why we do a dynamic warm-up. We're going to warm up things, rotator cuff, certain things that you don't think about. And then your likelihood of injury decreases. This is a man on top of the mountain doing a dynamic warm-up. Isn't that awesome? Isn't that awesome? He's at the top of the mountain, and so I do this for a lot of my clients that ski a lot, and they have ski boots on, and I'm like, it's really hard to do all this kind of stuff in a ski boot because they don't have a lot of ankle mobility. So it's really interesting. My husband found this picture, and I was like, wow, that's brilliant. He got down in the snow, he has a jacket on, he's just warming up his glutes. He's doing exactly what I talked about. Reciprocal inhibition. Getting the glutes to fire because his hip flexors are so tight from sitting. And from doing this, right? Okay. This study, I don't know if you can read this. I'm with the NSCA, and their research is amazing. And this was published in one of the journals in 2008, showed that athletes who performed a dynamic warm-up daily for 4 weeks showed significant improvements in strength, power, speed, endurance, flexibility, and agility compared to athletes who performed a warm-up of static stretching or doing nothing. These are my references. Mark Bergenstein. I have Elizabeth Quinn, who's a sports medicine expert, Paul Check, and my NSCA. And again, I wouldn't know what I know without these people. So I always want to throw it out there to them. And this is how we roll. We are going to start rolling. You ready to roll?
Where would you roll though without doing a dynamic roll?
I would always roll first.
Roll before the dynamic.
You roll first. So yeah, great question. Great question. So the fascia lays on top of the skeletal muscle. So what do you think needs to be rolled out? The fascia. The fascia first. Then, not saying that you're not rolling over skeletal muscle, but you want to roll first and get everything smoothed out so it can be lengthened and elongated. And then you start addressing your mobility and your skeletal muscle and putting it all together, right? More dynamic, more functional in some of these movements. Does anybody else? That was a great question. Thank you for asking that. Anybody else have a question? Yes, ma'am.
So just to summarize, so you basically work in.
You work
to warm up and move.
Yes.
You're working inward.
I mean, the fascia, yeah, sure. I mean, I would say the fascia is on top, right? And then you're rolling that out, getting that all smoothed out, laying on top of the skeletal muscle, and then then we start moving, increasing the blood flow through the movements. Is that kind of what you mean?
Okay.
Okay.
So
Yeah.
when do they do the dynamic? You do dynamic move after this.
Yes.
After the roll.
Yeah. And there are modified stuff. So if you can bear with me, it's a nice small class. If you can bear with me with some of the modifications of the dynamic warm-up, which I can totally show you. I can show you floor work as well as standing ones if you have any injuries or anything like that, because we can do standing or we can do on the ground. So depending on the individual. And that's what I want to share with you so you know how to do it and do it right. Any other questions? Nope? Okay. Then we're going to move this stuff and we are going to get going. You want to grab a foam roller, and let me explain. This is
torture device.
This is anybody who wants to be tortured. Yep. This is called the rumbler. It's got it's soft, but it's pretty intense. Anybody who wants to go for it may.